Hey guys, this is Dr. Kyle with ICE. I just wanted to go over our new segment with you that we're going to be introducing called Whiteboard Wednesdays. The idea that what I want to use this for is to try and get across concepts that maybe we need a little more of a visual aid for and give you some encouragement as far as ways that you can go about protecting your body. So in particular, we'll start this one off with shoulder health. How do I protect my shoulders? So this is a question I get very often in the clinic. Because as you probably know, as you ask people around you, I'm sure you've heard of rotator cuff injuries, labrum injuries, shoulder replacements, bursitis, tendonitis, all these different conditions that, in my opinion, if you are proactive about, you could potentially avoid in the future. So two things I want you to understand as far as our basic anatomy is concerned that will revolve around the good majority of shoulder conditions. One thing to appreciate with our shoulder are what creates the socket is our shoulder blade, which is essentially like a triangle shape that has a little cup on that. On that cup is called your glenoid cavity, and it's kind of what creates the socket part for the ball in your arm, your humerus bone, to be sucked up in there. Now, much like with your ball and socket in your hip, it's kind of a true ball and socket. But with your shoulder, it's more of a flat surface. So it kind of looks like that and that, meaning there's lots of different ways that ball can shift around that socket, and that essentially creates an unstable joint by nature. So what helps to create a better stable joint are all the ligament and tendon structures that we have around there. And one in particular I'm sure you've heard about is called your rotator cuff. Your rotator cuff is primarily four muscles that have tendons that kind of come off our shoulder blade and wrap around to create a little bit of a prong effect. And so with a proper tone in the actual muscle, it will kind of create a suction effect up into the cup. So when you have an imbalance in those four muscles, that creates more of a dynamic where there's instability in that joint, which can create bigger issues. Now, if we jump to the other point of anatomy I want to get at, this involves our thoracic spine. So basically everywhere of our back that includes a rib that you see would be considered our thoracic spine. By nature, our spine is supposed to be stable here and mobile here. A lot of times because of postural distortions, we end up having too much movement in our low back, and we get real stiff and stuck in our mid back. Again, because we're rounding our shoulders, we're usually slumping forward. So the problem is when we lose our mobility here, our brain will go searching for it in other places, and usually the next available joint is that ball and socket joint. So if you can appreciate those two dynamics about our anatomy, my biggest encouragement and solution for healthy shoulders would be to work on your thoracic mobility and to work on the strength of your rotator cuff. So I'll show you a quick little stretch that you can do. If you're able to get your arms in this position where you can grab with your fingers, I want you to try and bend forward and twist in the opposite direction. And you can do this a few times, a few reps, but the idea is you're working on that shoulder blade mobility and your mid-back mobility at the same time. And then as far as the strengthening exercise you can do, real basic, I just want you to focus on reversing the effects of poor posture. So if we're doing this all day long, what I want you to do is think of getting tall, sucking your chin back, and bringing you're trying to pinch your shoulder blades behind you. But the other added effect with that to incorporate your rotator cuff is I want you to turn your arms out like this. So going 10 to 20 repetitions a day like this will go a long ways as far as keeping a good strength here, but more importantly, making the tone of the rotator cuff keep that guy flush in socket. So real simple things you can do. Give it a shot, and it'll create a much better foundation for your shoulders in the future.